I really like to use data to tell a story, and everybody who knows, my husband's a historian, so I tolerate history too. So I thought as we prepared for this program, I'd take a look back. And as I look back nearly 50 years, I'm thinking about when the World Health Organization declared a goal of health for all by the year 2000. That aspirational commitment encompassed public health and the role of our communities in health and healthcare. And indeed, it took us decades before healthcare and health policy began to fully embrace the non-clinical factors that impact a person's health, their well-being. It's the environment where they live. It is the foods that they eat. It's the education that we pursue. It's the places where we live. And so when I arrived at NJHA about 5 years ago, one of the first things I did was to create NJHA's Center for Health Analytics, Research, and Transformation. My goal was to use New Jersey-focused data to better advance the linkages between social and economic factors and health status, and make sure that we were using that information to better tell this important story. So, about a year later, after I arrived at NJHA in 2020, the pandemic hit and placed a fluorescent, maybe I shouldn't use that word, light or spotlight on how individuals' health outcomes, in this case, the vulnerability to this novel life-threatening virus, COVID-19, was influenced by things like place and type of residence, occupation, and other social factors. Today, we're here to talk about opportunities for hospitals and healthcare systems to improve health outcomes through collaboration and shared learning. And when we talk about climate, chronic conditions, and social determinants of health, that connection isn't always obvious. But I want to give you an example or two of what our hospitals are seeing statewide. Last year, New Jersey hospital emergency rooms reported more than 206,000 visits for asthma treatment, an increase of more than 22,000 in just 1 year. Similarly, 22 data shows that New Jersey hospitals treated more than 75,600 patients for COPD in emergency rooms. That's nearly 8,000 more compared to 2021. We know that both of these are impacted by air quality and living conditions. And there's a growing body of science that climate change and rising temperatures create the extreme weather, and we know that that extreme weather is triggering these types of chronic conditions. Hospitals are large economic engines. They're providing $62 billion in jobs and other economic activity here in New Jersey, and that supports a whole variety of industries and business activities across New Jersey. But since our hospitals are that big blue H that we all navigate towards in a time of crisis, and they're open to their communities every hour of every day, they can also have a really large carbon footprint. So I'm proud to be here today with Hackensack Meridian Health and Atlantic Health System to discuss things that they are doing to address and to reduce that environmental footprint. That includes creating more energy efficient campuses, partnering with New Jersey utility companies through the Hospital Efficiency Program with a nearly $90 million investment in innovations for cooling and heating systems, air handling units, and other major equipment. I want to thank you all for being part of this important dialogue about the intersection of climate, environment, and health. And I hope that you carry what you learned today to help us rewrite our chapter in the history of environmental well-being and personal and population health well-being as we continue on our journey of overarching social justice and improved public health outcomes. So with that, I'm going to turn things over to my good friend from Rutgers and the head of the Rutgers Climate Change Institute, Dr. Marjorie Kaplan. She's also the co-facilitator of the New Jersey Climate Change Alliance, the New Jersey Climate Change Resource Center. I'm sure a couple other things that I'm forgetting. I've got to tell you, in addition to all this work in academia, I've got to say Marjorie has been a leader on climate issues in private and public sectors. Prior to academia, she also served as the New Jersey Department of Environmental Protection's very first Director of Office of Climate and Energy. Marjorie, I'm going to turn things over to you. Thank you so much for joining and partnering with NJHA today, and we look forward to hearing what you have to say. Thanks.
Thank you, Kathy, so much. It's really a pleasure to be here in partnership with the New Jersey Hospital Association for today's Climate Academy on opportunities for New Jersey health systems to address climate change, improve health, and advance health equity. As the co-director of the New Jersey Climate Change Resource Center at Rutgers, it's our pleasure to partner with you and to provide this service to the constituency of folks in the healthcare world. Today's webinar is going to last until 1:30, and other than today's presenters and the team behind the scenes, the folks watching are muted, so to communicate it with us, please type your questions into the chat box, and we'll get to as many as we can during the Q&A portion at the end. And I'd like to thank our colleagues from the New Jersey Hospital Association for hosting today's webinar. In addition to Kathy, we'd like to recognize the great help of Victoria Brogan and Natalie Jones. And we'll also be recording today's webinar, and we hope to have it on our New Jersey Climate Change Resource Center website. We're thrilled to have two national experts with us this afternoon who'll talk to us first about where things are nationally. Then we'll hear from local colleagues who've been leading the way on addressing climate change within healthcare settings here in New Jersey. We'll have time at the end for responding to questions, but let me introduce our first panel. Our first speaker is Joe McCannon, Senior Advisor for Climate, Health, and Equity within the relatively new Office of Climate Change and Health Equity at the U.S. Department of Health and Human Services. Joe is going to speak to us about this new office and achieving HHS's mission in the 21st century. Joe will then be followed by Jessica Marks. Jessica's Program Officer for the National Academy of Medicine Action Collaborative on Decarbonizing the U.S. Health Sector. And Jessica is going to talk to us about this National Academy of Medicine Collaborative. So with that, I invite Joe to take it away.
Well, thank you very much, Marjorie, and thank you all for the opportunity to join you here today. I'm looking forward to the session in part because I'm energized to share with you more information about our office and its work, and in part because I'm looking forward to hearing in more detail about the great work that's happening in New Jersey. I'm going to try to give a full description of the office and its mission and some of the resources we make available. But before I do that, I do just want to take a moment to say a little bit more about why we're here, and both why we're here as an office and I think why we're all gathered on the webinar here today. And that's to do with what you heard both Kathy and Marjorie referencing with respect to the magnitude of the health threats presented by climate change. So a little over a year ago now, more than 200 medical journals released a consensus statement saying that climate change currently, not in the future, currently represents the greatest threat to global public health. You know, I think we understand that not only has to do with the catastrophic acute events that we read about in the news, the superstorms, the wildfires, the flooding, the extreme heat probably above all, but it also has to do with the chronic sequelae and the infectious disease sequelae associated with climate change, everything from the cardiovascular disease burdens and respiratory disease burdens that you heard about a moment ago, to increasing vector-borne and waterborne illness, to increasing mental health challenges that we know are growing by the day and causing great stress and strain on people living in the United States. So we're in a moment of growing stress, of growing crisis, and what we understand as an office is that, like all public health challenges in this country, the impacts of that stress are not distributed evenly. So based on years of discrimination, underinvestment, disenfranchisement, there are communities around the country that are less prepared for the impacts of climate change that are disadvantaged when it comes to opportunity and infrastructure and the ability to respond in a resilient way. And so when climate events happen or when there are long-term problems introduced by climate change, they are going to suffer disproportionately. And, you need to look no further than what happened in Jackson, Mississippi this fall to understand how the long-term underinvestment there in infrastructure combined with a catastrophic climate event led to the buckling of the water system and the inability to have safe drinking water and a lot of suffering in turn. And so that's just one of scores of examples that I could share with you of the kinds of challenges that we see emerging around the country as the consequences of decades-long discrimination and underinvestment and vulnerability combined with the impacts of climate change come together in these ways. So that's really the backdrop, if you will, for our office and its creation. That's not to say that the federal government and the Department of Health and Human Services haven't been thinking about climate change to some degree for the last 10 or 20 years. There's a climate and health office at CDC that works at a state and local level in certain areas of the country to pilot frameworks and approaches that strengthen public health responses to the impacts of climate change. The NIH has had research in the National Institute of Environmental Health Sciences that has bearing on climate change, and that's growing. The Assistant Secretary for Preparedness and Response, which responds to crises of all kinds, all hazards around the country, is increasingly thinking about climate change. But there was never really a purpose-built entity or a purpose-built office within the Department of Health and Human Services to focus on climate change's impact and to mobilize the entire department, this trillion-dollar-plus department, to think about how to offer resources and supports to those individuals and communities in the United States that are grappling with the challenges of climate change. And that is why in its first week in office, the Biden administration introduced in an executive order called Executive Order 14008, Tackling the Climate Change at Home and Abroad. It introduced the Office of Climate Change and Health Equity and authorized the Secretary of HHS to stand that up. It was formally launched in August of 2021 in the Office of the Assistant Secretary for Health, Admiral Rachel Levine, who we report into, and it has a mission that's both simple and incredibly ambitious, which is to protect people in the United States from the impact of climate change, particularly vulnerable groups and populations. And so with that as a starting point, we as an office set out at the end of 2021 to really try to describe and capture what we hope to create across the United States, the future reality that we hope to stimulate and support through our office and through the work of partners inside and outside the government. And this is the vision for climate, health, and equity that we created shortly after our establishment. We said that in the next 5 years, we want communities and healthcare organizations that serve them to be prepared for disruptive and chronic climate impacts of the kind that we've been describing, particularly for vulnerable populations, for elderly populations, for rural populations, for communities of color, for indigenous populations, for LGBTQIA populations that we know bear these disproportionate burdens, to make sure that we're preemptively and thoughtfully managing their needs. Secondly, to make sure that healthcare institutions themselves, so certainly hospitals, but also health centers, nursing homes, and many other provider types are prepared to avoid disruptions in operations that are associated with climate change, so that there is no situation like the one that we observed this fall in Florida, where a number of facilities had to close down, where we can avoid transfers during the time of these crisis situations. where every hospital and health system is thinking not only about how it prepares to become resilient to climate change impacts, but thinks about its own contributions to climate impacts and to emissions, and so publicly tracking greenhouse gas emissions and supporting organizations to get on a path to net zero is a major part of the focus. And then making sure that public sector investments to reduce greenhouse gas emissions are mindful of health impacts, so that, you know, wherever we have new investments being made in climate-ready infrastructure, we think about the associated health impacts and respond to those. And we're seeking to work through all HHS operating divisions to achieve this vision and get to the place that's described here. The way we've started here is by focusing in the last year to 18 months on getting crystal clear about our objectives and communicating those to the country and to the world. That started at the United Nations Climate Conference, COP26, in November of 2021, when Admiral Levine, who you can see pictured there, announced on behalf of the Department of Health and Human Services in the United States our commitment to build a low-carbon and resilient healthcare system. And shortly thereafter, there was another executive order issued, Executive Order 14057, which requires all federal facilities, including federal health systems, to meet the administration's goals for both resilience and emissions reduction, roughly matching the administration's goals of reducing emissions by 50% by 2030 and getting to net zero by 2050. So that was all kind of set up or prelude, and then not a month after that, the entire department at the Department of Health and Human Services and its new strategy committed to a strategy to mitigate environmental factors and specifically the impacts of climate change. So the start of our work has really been about creating a vision and establishing a set of objectives for what we want to pursue. And then what we did last spring around Earth Day is we created an opportunity for the private sector to match the administration's intent, to match the work of the federal hospitals and health systems, the VAs, the Defense Health Agency, the Indian Health Services of the world, and show that they were going to make equal commitments to emissions reduction and resilience as a part of the administration's work. So we launched something called the White House HHS Healthcare Sector Climate Pledge, and between Earth Day and the United Nations Climate Conference this year, COP27, there were more than 100 organizations that signed up to join the pledge, being very explicit about their plans to develop resilience supports for their organizations and to become more resilient in the long term, and then making these quantifiable commitments to reduce greenhouse gas emissions as well. And you know, the response that we've seen, I think, nationwide and in New Jersey is very encouraging. And I think we're going to hear from organizations that have signed the pledge that are excited to talk about the work that they've done. And you can see in this slide here the pledge signers with New Jersey ties. I should suggest that, you know, some of these aren't anchored mainly in New Jersey, but most of them are. And we're excited to celebrate their commitments and contributions. So making a pledge, of course, is one thing, and we do really celebrate that. But at the same time, it's not enough. And given the urgency of the crisis we face and the demands and the stresses and pressures that the healthcare system are under, we need to make sure that we introduce resources and support to help them navigate this challenging period. And so we've moved from issuing the pledge opportunity and receiving pledges to introducing federal resources to support climate resilience and emissions reduction. And so if you go to the OG website and you'll see a link in the chat, you'll be able to access a compendium of financing resources that are available from agencies across the government to help healthcare organizations make investments in resilience and renewable infrastructure. And you'll shortly see connections to other resources and supports that will be available soon as well. And I think there's a link there now that takes you to those federal resources. In addition, as an office, what we've done is we've created a monthly climate and health outlook, essentially a forecast, not only of the acute weather events, the challenges presented by climate change, but the specific impact on specific areas with respect to specific health conditions. So where do we think, based on wildfires, we're going to be contending with the most respiratory issues? Where do we think, based on extreme heat, we're going to be dealing with cardiovascular challenges and other challenges? That's what this Outlook resource is about, and there's a link in the chat about that as well. So that's yet another thing that you're able to access as a function of this work, and gives you a sense of what we've been trying to do to not only exhort change among organizations around the country, but support it as we go. And there's no greater example of that potential support for change than the Inflation Reduction Act, this landmark piece of legislation that was passed this August, which, of course, for those of us in healthcare, we understand relates to Medicare Part D, relates to the expansion of ACA benefits, but really in a major historic way makes major investments in climate-ready infrastructure and through a combination of tax incentives and grants and technical assistance will create opportunities for your health systems that should really be an order of magnitude larger than anything we've seen before. And so we will be introducing a resource hub and a set of webinars that will introduce what's available in the Inflation Reduction Act over the course of the coming months, and we'll introduce a compendium of resources that will describe those resources in more detail as well. So lots to come there. I would say watch this space, and we really stand at the ready to work arm in arm with you all in the coming months. In addition, I'll just finish by noting that we are a small office, and what we're doing really only scratches the surface of everything that's happening across the government and across the country. And so part of what we will do is act as a conduit. We'll share what we're learning from the communities at highest risk, which influences our agenda and our thinking. We'll share resources from other agencies, many of which are responsible for the implementation of the elements of the Inflation Reduction Act that I described. We have a federal health systems learning network with the VA, the Defense Health Administration, the Indian Health Service. We cut a window on that a few times a year and describe what we're learning there. We work with all HHS operating divisions. In fact, I just got off a call hearing about their strategic plans for the coming year, and we'll be sharing that with the country. And then we work with the private sector as well, and you're going to hear about that in a moment here from Jessica regarding the work of the National Academy of Medicine Climate Collaborative, which brings together public and private sector stakeholders to collaborate on goals and to generate resources together. So all of that is a part of what we're trying to facilitate, and we're excited to see what it will create in the coming year. So I'll just finish where I started by saying thank you for the opportunity to be here with you today, and I will turn things back to Marjorie as we transition over to Jessica.
Thank you so much, Joe. And folks, if you have specific questions, more questions for Joe, throw them in the chat and we'll get to them later. There's one or two in there, but please be mindful that we're here to get to them. So thank you. I'd like to now invite Jessica Marks from the National Academy of Medicine's Action Collaborative on Decarbonizing the U.S. Health Sector to join us. Jessica?
Thank you so much, Marjorie. It's a pleasure to be here today. My name is Jessica Marks, and I'm a program officer at the National Academy of Medicine, where I work on this action collaborative. I want to thank the New Jersey Hospital Association and the New Jersey Climate Change Resource Center for inviting me here today. For those who may not be aware, the National Academy of Medicine, which is formerly the Institute of Medicine, is one of 3 academies that make up the National Academies of Sciences, Engineering, and Medicine. And the national academies are private nonprofit institutions that work outside of the government to provide objective advice on matters of science, technology, and health. And during my presentation today, I will focus on the NAM's Climate Collaborative, which is a public-private partnership to accelerate decarbonization and resilience of the U.S. health sector. And in particular, I will point out various opportunities, resources, and tools for hospitals and health systems that are emerging from our work. As you heard earlier, climate change is increasingly affecting people's health and the ability of the U.S. healthcare system to effectively respond to increases in extreme climate-related events. Yet at the same time, the healthcare system is also contributing to climate change. Healthcare accounts for nearly 20% of the U.S. GDP, making it a major consumer of resources, and as a result, a major producer of waste and greenhouse gases. In fact, the U.S. health sector is responsible for 8.5% of U.S. carbon emissions, and these emissions stem directly and indirectly from the operations of healthcare facilities, which is classified as Scope 1, purchased sources of energy, heating, and cooling, which is Scope 2, and the supply chain of healthcare services and goods, Scope 3. These emissions stand to have major impacts on human health, which the system is supposed to protect, which you all likely already know, or else you wouldn't be here today. The disease burden associated with the health sector's emissions has been estimated to be on the same order of magnitude as deaths from preventable medical errors. And of course, these impacts are and will continue to disproportionately impact historically marginalized communities, which Joe spoke to earlier as well. So it's clear that addressing the carbon footprint of the U.S. health sector is a major opportunity with clear health, social, and economic benefits. Now turning to the Action Collaborative. This initiative was formally launched in September 2021 as part of a larger initiative at the NAM called the Grand Challenge on Climate Change, Human Health, and Equity. We have a few other programs associated with that effort, but this one in particular, as I mentioned, is a public-private partnership that convenes leaders from across the health sector to co-develop and implement a shared action agenda. And as Joe mentioned, OCHI is a member of the collaborative, and Assistant Secretary for Health, Admiral Rachel Levine, serves as one of the 4 co-chairs of the initiative. The Action Collaborative focuses its work around 4 priority areas, and these 4 areas also correspond with the 4 working groups of the collaborative. And that includes the healthcare supply chain, healthcare delivery, health professional education and communication, and policy, financing, and metrics. Altogether, the Climate Collaborative currently has over 70 participating members representing diverse stakeholders from across the health sector, and which you can see listed here. And there'll be a link in the chat shortly that has directs you to a webpage of a list of all of our members. This visual just provides a representation of the Action Collaborative structure. It is guided by an overarching steering committee that provides guidance on the strategic directions of the collaborative and its core activities. And the membership is distributed across 4 working groups. And you'll see here that the policy, financing, metrics working group is cross-cutting and includes members from the 3 working groups above it. I'll also note that you can see in the blue teal color network organizations. These are affiliate organizations who do not participate in the day-to-day work of the collaborative, but are aligned with and support the mission and priorities of the Climate Collaborative. To date, we have about 60 organizations participating in this network, including the New Jersey Climate Change Resource Center. And I'll go into more detail later about how to become a member of or a network organization for those who may be interested. And now in the next few minutes, I plan to discuss each of the working groups and their activities, and especially want to point to resources and tools for hospitals and health systems. So as many of you may know, the healthcare supply chain is responsible for 71% of the health sector's emissions globally. In the US, the supply chain is responsible for a little over 80% of the sector's carbon emissions, with pharmaceuticals and chemicals being the largest contributors. As these figures indicate, there is a tremendous opportunity to reduce the health sector's footprint by focusing on the healthcare supply chain. And as you can see here, that is just what the Healthcare Supply Chain Working Group is addressing through both their working group charge and their areas of focus. I wanted to highlight in particular 2 activities emerging from the work of this group. The first is a climate journey map and resource repository. And this will be an interactive infographic that's designed to help supply chain companies either start or accelerate their sustainability journeys. This resource could also be useful for hospitals when making purchasing decisions and/or to learn more about Scope 3 and indirect emissions in particular. This working group is also producing a series of papers and case studies, one looking at opportunities to expand digitization and reduce paper waste, one focused on minimizing waste in healthcare packaging and developing more circular solutions for healthcare products, and another looking at greenhouse gas emissions reporting. Next, I'll turn to healthcare delivery, which may be of particular interest to this group. The health sector's Scope 1 and 2 emissions amount to just under 20% of the sector's total emissions as compared to the supply chain, still making healthcare delivery another clear area of opportunity. Importantly, several hospitals and health systems across the US are already moving to decarbonize, including Kaiser Permanente, Providence St. Joseph Health, Common Spirit, just to name a few. And organizations like Healthcare Without Harm have been important in helping galvanize this movement. However, decarbonization initiatives across health systems more broadly has been really limited. And some of the challenges that we hear from our working group members and beyond is that there lacks a really clear business case or financial model for decarbonization. There's insufficient financial and payment incentives. There's a lack of shared or commonly accepted measures, and there's inconsistency and variability in measuring and reporting emissions. And the healthcare working group is addressing these challenges by different areas of focus. As you can see here, their working group charge is to scale sustainable, quality, and equitable health operations and practices, including reducing the carbon footprint of healthcare delivery organizations and unnecessary healthcare services. I wanted to highlight 3 activities in particular that may be of interest. The first is a discussion paper that will be published early this year that is making the multifaceted case for health systems and hospitals to decarbonize. And this is really the why. While the core audience is healthcare organization, C-suite leadership, we recognize that this paper can be relevant for anyone throughout the health system. And so we're really trying to unpack and describing why healthcare leaders should care. And then the second, to complement that discussion paper, is a C-suite feature story in which we'll be inviting 5 healthcare organization CEOs that highlights their why and serves as a peer-to-peer exchange of knowledge to complement that discussion paper so that there's examples from other leaders describing their journey to decarbonize and sustainability. And then we also are planning for convening this spring, which will be adjacent to the American Hospital Association members meeting. And this convening will bring together C-suite leadership to discuss solutions and approaches to overcoming commonly encountered barriers. And if your hospital is a member of AHA and you think your CEO might be interested in attending, please let me know. The working group currently is also prioritizing additional activities for this year, in particular linkages between care pathways and decarbonization, as well as developing a best practices guide for hospitals and health systems. Next, I'll turn to the Health Professional Education and Communication Working Group. As many on this call already know, clinicians are uniquely positioned to communicate and elevate the health impacts of climate change, given that they are among the most trusted and respected professions. Across clinician groups, there has certainly been heightened recognition that climate change is impacting the health of patients and communities, yet we've seen on a whole that there is limited training on the linkages between climate and health. And while there are new programs on climate and health emerging across clinical education, they're still quite limited in numbers and scope. And as you can see here, this working group is addressing some of these challenges by a variety of focus areas, really centered on building capacity. I wanted to highlight two activities in particular. First is a series of focus groups that the working group has been convening over the past few weeks that are being held to better understand the knowledge gaps, barriers, opportunities to leverage and engage health workers, learners, educators, patients, and community members in decarbonizing the health sector. And then to complement these focus groups, the working group has also developed a public survey, which is open through March 10th, that asks similar questions of the focus group participants. And we welcome all of you to submit your responses. And through that survey, if you are interested, and there'll be a link to that survey provided in the chat, we envision that the survey and focus groups will inform the work of this working group. And they're interested in developing a framework of action to address any further opportunities to expand capacity for greater education and communication on climate and health, as well as decarbonizing the health sector for these stakeholder groups. And then second, we are planning for an education leaders convening this year, in which we want to bring together the leaders of health professional schools and academic health centers, including both executive leadership, but also faculty and students, to identify opportunities to build greater capacity for climate and health education. And our learnings from these focus groups will also inform that convening. And lastly, turning to the policy, financing, and metrics working group. Progress across the healthcare supply chain, care delivery, and health professional education really hinges on having supportive policies, payment, and financing, as well as transparency and accountability through reported metrics. And as such, the policy, financing, and metrics are addressed individually across the other three working groups, and then they are coordinated through this fourth working group, which is made up of the members of the other three groups. And as you can see here is their working group charge and their areas of focus, which I will go into more detail. The first activity that I wanted to highlight as a resource for this group is a series of carbon accounting clinics that were held from November to January. These carbon accounting clinics were designed to teach carbon accounting to healthcare delivery organizations, either interested in starting or accelerating their efforts. The clinics discuss carbon accounting for all three scopes, including what data to collect, how to measure and report data, while adhering to the greenhouse gas protocol. When we held these clinics, initially they were only open to the Action Collaborative members and network organizations, but we will be making this available as a public resource in the coming weeks. And as you can see here, just for further information about these clinics and the information shared, Clinic 1 covered scopes 1 and 2, and then Clinic 2 and 3 divided scope 3 into 2, and you can see what was covered as well as the speakers. And I just wanted to also highlight two additional deliverables emerging from this working group. One is the working group is putting together a paper series on a policy and regulatory agenda for decarbonizing the health sector, which is based on key barriers and opportunities identified by all the working groups. Just as one example, there's going to be, they're exploring a paper, two papers on payment and financing, one looking at reimbursement for sustainable healthcare delivery through public and private insurers, and then another tapping into policy and finance opportunities to incentivize decarbonizing healthcare facilities. There's also another paper on healthcare facilities themselves, looking at building energy emissions. And then there's also going to be a paper on opportunities for strengthening climate education for health professionals, just as a few examples of the topics to be covered. And there also is going to be a paper on financing healthcare decarbonization. This really complements the healthcare delivery discussion paper I discussed earlier, whereas that's the why. this paper is more so going to be the how and really focusing on those financing mechanisms. And lastly, I just wanted to share some more information about how to join the collaborative as a network organization for those who may be interested in this opportunity. Network organizations are limited to organizations, legal entities rather than individuals who are not already members of the collaborative. And these organizations are committed to supporting the priority areas of the Climate Collaborative and make a visible commitment outlining their institution's current and/or future work and the priority areas of the initiative. And they also actively support and contribute to the work of the collaborative. And as you can see here, they are listed on the Climate Collaborative's webpage. They receive priority invitations to meetings and advance notice of resources and tools. They have opportunities to provide input on activities. They receive communication tools and receive networking and information sharing opportunities. Additional information can be found on the NAM Climate Collaborative webpage, and there's a link that will be dropped in the chat with a further overview of the network organization opportunity, as well as a link to apply, and we review those applications on a rolling basis. And again, I just wanted to thank you for your time today. I appreciated the opportunity to share with you our work at the National Academy of Medicine. As you can see here, there's a link to our NAM webpage on this activity. And we also have a monthly listserv that goes out if you're interested in joining that. And if you have any questions, please feel free to email our team at climateandhealth@nas.edu, or you can also feel free to email me directly at jmarks@nas.edu, and I'll put that in the chat as well. Thank you so much.
Thank you so much, Jessica, and also to Joe for your very informative presentations. And so folks can continue to put notes in the chat that we'll get to later. But now to respond to the information from Jessica and Joe and that they've presented and augmented, if you will, regarding local healthcare experiences, we have two panelists from New Jersey healthcare systems that I'd like to introduce. First, we'll hear from Kyle Tafuri, the Vice President of Sustainability at Hackensack Meridian Health System. And then we'll hear from Karen Koppa, Manager of Occupational Environmental Safety at Atlantic Health System, who'll join Kyle to report on her perspectives, including experiences within her health system. So I'd like to first invite Kyle to share his perspectives on what our panelists have presented and on his work with Hackensack Meridian.
Thank you, Marjorie, and good afternoon, everybody. You know, I think that as healthcare has evolved, and especially, you know, being a part of Hackensack Meridian Health, and when I first joined Hackensack Meridian Health, I mean, it was actually started at Hackensack University Medical Center. We were one hospital, and that was around 11 years ago. And as we evolved, you know, with all the good that we do, we have a heavy footprint. And I think you saw it before, you know, with healthcare and how much we contribute in terms of greenhouse gases to climate change. It's a lot. And I think that as healthcare has evolved to more population health and prevention, you know, all of what I'm going to talk about from a health system perspective and the initiatives that we're working on, it all aligns with our strategic priorities. When you talk about looking at reducing chronic disease, you know, providing health outside of the four walls of the hospital, and not just, you know, being acute care, working on the sick part, but really looking at wellness and healthcare of the future. So Hackensack Meridian Health, as I mentioned, you know, we have 18 hospitals in the state of New Jersey, over 500 offsites. In a lot of cases, you know, we're the largest energy user, largest water user, largest. We have a lot of chemicals, you know, within our operations. We produce a lot of waste. We have a heavy footprint on the communities that we serve. And, you know, when we started out on this journey, you know, we've been very fortunate. Our CEO, Bob Garrett, has really pushed us to move further and to really be a leader in this work. And, you know, when we first started out, you know, we would put out a press release here and there about the work we were doing. But as time went on, you know, it went to putting op-eds out, to being at Davos, you know, and really he has been on the forefront in talking about this, supporting this, empowering us to do a lot of work to address climate change, but really aligning it with our mission and aligning it with our strategic priorities, because, you know, so much is going on in healthcare, you know, whether it was even prior to COVID, you know, all these different changes. And when this work is just an add-on to a health system, you know, it's tough, you know, it's something that's kind of on the outside, and you're just doing initiatives to be a good corporate citizen. But, you know, we were really challenged, and it's easy in a way to align it with all that work that we're already doing. You know, some of the key partner, and these aren't the only partners we've had, but it's our partnerships have been a key to the success in what we've been able to accomplish. And I'll show that, you know, in terms of whether it's with energy or food. And, you know, we've partnered up with Marjorie's group and her team. You know, we signed on to the HHS pledge early on. But, you know, in New Jersey especially, there is something that I wanted to highlight is we're very fortunate in that there are a number of programs for hospitals to take advantage of. And, you know, one of the big ones has been around energy. And with we've invested over $115 million in energy efficiency work. And that's been in partnership primarily with our utilities. And it's been something where we have no outlay in capital. The initiatives are paid for, you know, whether 40, 50% of the cost is paid for through savings in on-bill financing. And it's really allowed us to make commitments to the HHS pledge and to really make substantial progress in our climate journey. Because this is really, it's a journey. You know, there's a lot happening. There's a lot to do, and it can be overwhelming, but and really just one foot in front of the next, and just starting to get into the work. Having programs like these utility partnerships has been a tremendous value. You know, you can't do it on your own. And I think, you know, to what, to Joe and the resources that he referenced that are available, to Jessica talking about what they're doing with NAM, you know, you can't do it on your own. And, you know, we're a part of the Healthcare Without Harm Climate Council. We joined the World Resource Institute, the Cool Food Pledge, around reducing emissions from food. You know, we're a part of the Department of Energy Better Buildings Challenge. How I mentioned before in terms of leadership, early on, you know, you learned pretty quickly that you couldn't do this on your own. So we said, hey, you know, it's tough. You know, it's healthcare is not easy. You know, always different emergencies happening, and always these different priorities popping up. You know, we need policies to be in line to support our work. So we had partnered up with Ceres, with companies, leading companies around the country, really the world, to see about, you know, for clean energy, how are policies in alignment making it, you know, easier for us to implement renewable energy, for us to invest in energy efficiency, you know, smart transportation and different things, you know, really making sure that there were policies that were in line with what we were doing. So what I mentioned about energy before, you know, since 2011, just about $115 million in energy efficiency investments, you know, with annual savings of over $10 million a year. You know, when folks say, oh, addressing climate change, it just costs money and all that, you know, saving energy, reducing waste, reducing, you know, the amount of products we use. I mean, it's about efficiency. It's about operating more efficient. And that's something that as healthcare systems, especially with all the supply chain shortages you have today, it's about using the resources responsibly. And when you frame it like that, and when you align it like that, you know, it's really, you know, it's just a part of how we operate. And, you know, we're not perfect, and there's a lot more that we can be doing. but that's where we encourage and empower team members to come up and identify opportunities. And energy is obviously a bulk when you're looking at scope 1 and scope 2 emissions. You know, the bulk of it, and having partners with these utility programs has really helped us drive and gather momentum to move this work forward. You know, we've been expanding outside of our hospitals, and actually something else wanted to mention here. You know, we have a school of medicine, and we have an environmental health module in our human dimension program that teaches about climate change. And you can't be committed to this work if you're not educating the future doctors and the future healthcare leaders about this work. And we talk about it, especially being in New Jersey with being hit with Hurricane Sandy and seeing extreme weather and different things. We're educating our future healthcare leaders, and I'll tell you, when I just a couple weeks ago lectured at the school to our first year students, and I'm talking about this work, and this always happens. I'm so proud of the work that we're doing and all these things. And when a couple of students come up after, and I'm talking about it, they said, "Well, yeah, we're supposed to be doing this," and it knocks me down off the ladder a little bit because it's true. And when you talk about the generations and the future generations, this is something that they expect. And it's something that, just recently met with our senior vice president of talent acquisition, and they're asking that, we talk about this work that we're doing when we're recruiting folks, because I'm sure everybody here knows very well the challenges that we have with staffing and finding folks to work within these health systems. So, this is something that, we're doing. Is it going to be the main reason somebody comes to work here? I'm not sure, but it's something that, we're really committed to this work. And, it's something that we're starting to really talk about more. Electric vehicles, we had partnered with a company, Volta, which, provided these. They actually were paid rent to have electric vehicle stations on some of our sites, but we've also have through partnerships with our utilities and just on our own going out, we have over 75 charging stations in our network. It's continuing to grow. And that's another thing, one of our hospitals, we put out a survey saying, okay, how many folks have EVs? Let's just put out a survey. And, only a couple team members responded that they had it. So we installed, 12, 14 charging stations. And the first day I was getting calls from security saying, "Kyle, we have EVs filled up all of our charging stations. Like, we need more." So it's something that, it's coming, and it's whether you want to be on the forefront of it or playing catch up is really what we've definitely learned. And then, as I mentioned before, around policy with the Inflation Reduction Act, we were meeting with legislators, talking about, and there's some changes that have been made, whereas as a not-for-profit, if you're installing on-site solar generation before that tax credit, you're eligible to receive that directly as a direct payment, I believe 30% tax credit. So we advocated for that because it's policies like that that are going to help propel us forward in meeting the HHS pledge that I talked about earlier. Physician engagement, this is something that it's one thing for me to go out talking about this work, but Dr. Walter Weinkoop has been a critical care pulmonologist. So if anybody to talk about climate change, and what pollution has, how it impacts health, a critical care pulmonologist, is front and center in that work. And a while ago, when there was some talk about, promoting clean transportation, I believe over 50% of the emissions in New Jersey comes from pollution from transportation. He gave a talk with on a webinar, and it really hit home for him because this is coming out of COVID. He saw firsthand in the ICUs, critical care pulmonologist, you're seeing, you know, vulnerable populations in some cases being hit harder. And he saw that when you talk about health equity, you know, transportation with the ports and all the travel, you know, if you're looking at Newark, at Camden, there are different areas that are being hitting with the burden of this. So we were out there, you know, using our physicians to talk about, and in a lot of cases, I didn't have to ask them. They were coming to me saying, hey, you know, I want to get out this message of health, you know, that this isn't something just about being green and saving the environment, which obviously, you know, those things are important, but this is about human health. And when you look at the basics of healthcare, clean air, clean water, healthy soil, you know, all of this is crucial. So another big part, I had talked about the Cool Food Pledge that we have before. It's in line with healthy eating. You know, this isn't something that we're just adding on. This is something that we talk about having more plant-forward menus to begin with, and pushing plant-forward and plant-based diets. And you know, I shadowed Dr. Andre Gua, who's our chair of oncology for the network, and he was talking about to his oncology patients about, you know, going on a plant-based diet. And you know, I said to him, I said, you're just saying this because I'm the green guy and I'm following you around. And he said, oh, it has nothing to do with you being here. You know, this is something that I talk about with my patients anyway. And we've had a tremendous progress in, you know, we've cut our emissions from our baseline year just in meat by 42%, our greenhouse gas emissions. And, you know, by the way, it does save money because meat is the most expensive of the food items when you're looking at your food spend. But, you know, we're not saying, oh, you know, hey, come to Meatless Monday and you know, having chefs just show like, oh, you know, we're going meatless, so here's this plant-based food. We're challenging our chefs to create dishes that, you know, are exciting. You know, they're different, they taste good, and it tastes good. It's good food. And we have events, you know, one of our hospitals, they call it Cool Food Catering. So for meetings, you know, they would have plant-based catering. So folks couldn't order meat options. Now that's not, you know, the everyday norm, but when they were doing it, they were educating and talking about, you know, the health benefits of plant-based food, the environmental impact of reducing this. And, you know, we really engage our team members around education. Listen, you know, especially with COVID, information overload and not a lot is going on. So, you know, you're not always able to talk about it all at once, but we're continuously trying to do it. We have a long ways to go, but, you know, in partnering up with initiatives like the Cool Food Pledge, you know, we've really made a lot of progress, and it's just another angle for us to push that on. And then obviously hospitals love awards. You know, we love recognition. And, you know, Hackensack University Medical Center, for the work that they've done, 8 years in a row, top 25 green hospital, one of 2 hospitals in the country to get that recognition 8 years in a row. And then along with Jersey Shore University Medical, Ocean University Medical Center, Bayshore Medical Center, you know, it's something that our hospitals get competitive just amongst each other in this work, which, you know, I mean, the climate crisis is real. So whatever gets us propelled forward, you know, we're going to do. But we've had tremendous amount of engagement, and the recognition just goes to show, you know, to validate the work that we're doing, and to show folks that they're really making a difference. So, you know, that's just from our perspective at Hackensack Meridian Health. So I'll turn it back over to Marjorie, and Karen to talk about the great work that Atlantic's doing.
Thank you, Kyle. We know you've been working in this space for a very long time and had a terrible, had to really switch your gears during COVID, and we're so glad you're back with us. And so I would really like to now invite Karen Coppa from Atlantic Health System to provide some perspectives on today's topics and presentations, and to talk a little bit about your work at the Atlantic Health System. Karen.
Sure. Good afternoon, everybody. So my name is Karen Coppa. I'm the manager of occupational environmental safety at Atlantic Health System. I've worked with the organization for about 6 years now. When I started working here, I noticed one thing. All of our different sites, similar to Hackensack, we have a lot of different hospitals. We have 6 different hospitals. All of our different sites were doing great work in all the areas of environmental sustainability, but we weren't really sharing them across the system. We are also doing great work in our social equity areas, but again, working sort of in silos. Same thing with governance. So I'm really excited to announce that after our 6 years of work, sharing our best practices across the system, working in tandem with Practice Green Health and our other partnerships, we were able as an organization to form an environmental social governance group this year. It has commitment from the highest levels of the organization, representation from everything from legal to our physicians, to operations crew and procurement. We were also this year in 2022 able to publish our first report for our ESG and present it to our board of directors. So this is a huge accomplishment. We are looking at these 3 main areas in environmental, building sustainability for our planet, social, building equity for all people, and governance, building an ethical global marketplace. At AHS, we really decided we can't really do one right without working on all 3 of these areas. At the most basic level, our desired outcome for our ESG group is to continue our work in environmental in the areas of sustainability, but also for social to continue our work toward equity, and for governance to maintain our integrity while we're doing it. In the area of environmental successes, I'm going to be talking about our environmental successes a lot because that shows the significant impact that we've made on our carbon emissions. We did in fact sign the HHS Healthcare Sector Climate Pledge back in October. We pledged to, at a minimum, reduce our organizational emissions by 50% for 2030 and achieve net zero by 2050. We do have our ESG group, which is designated an executive level lead for work on reducing emissions and conducting an inventory of scope 3 emissions by the end of 2024. And we are currently working on developing and releasing a climate resilience plan for continuing operations at the end of 2023. All of this work, again, goes in line with the ESG that we just formed. Here are some of our environmental successes. Now, I'm not going to go through all of them, but it goes from our smaller successes to our larger successes. As Kyle mentioned earlier, we do receive our awards and we like to receive our awards. We were recognized with 6 awards in 2022 from Environmental Excellence from Practice Green Health, including also the System for Change Award for our entire system. We were named the 2022 CIA&NJ Company That Cares. We received the Platinum Award for Environmental Conservation, Sustainability, and Recycling. We were able to eliminate styrofoam system-wide. Additionally, single-use plastic bags, paper bags, plastic straws, and polystyrene food containers prior to our state-mandated deadline of May of 2022. In 2021, we distributed over 26,000 reusable grocery bags to team members throughout the organization. In return, we collected over 200,000 plastic bags that we sent out for recycling. I'm going to go into a little more detail on our solar project later. We were also able to install waste dehydrators at 2 of our hospitals. They are food waste dehydrators that are installed in our kitchen, and the byproduct can get tilled in as fertilizer in soils in our gardens. I'm going to be going into more detail on our Morristown Cogen facility in the next slide. But we've also been selecting new roof installations that incorporated white vinyl roofing. This allows us to reflect 80% or more of the sun's rays and emit at least 70% of the solar radiation that the building would normally absorb. AHS also celebrated Earth Day. We distributed over 10,000 tree saplings to our team members to plant. Additionally, we were able to donate over 1,500 trees locally to Morris Township to continue their tree replacement program. So again, from the large projects to the smaller projects, all of them have an impact on our carbon footprint. Environmental successes at Morristown. We added another cogen plant in 2022. It went live January 4th of 2022. About 7 years ago, we implemented a cogen plant at Overlook, our sister hospital in Summit. Seeing the successes of that and the benefits and everything, we decided to move along with a project at Morristown. It's a $22 million facility that was installed. It was one of 18 capital construction projects across the state that was honored by the New Jersey Alliance for Action. The plant is expected to save about $2.3 million from the hospital's $6 million annual energy bill and reduce yearly carbon emissions by about 4,200 tons. It's really the equivalent of removing about 2,600 vehicles from the roadway. To accomplish this, as Kyle mentioned, we do have very strong partners with our utilities, and we received a $3 million grant from the Clean Energy Program to help fund this project. In addition, we're working on going solar. So at 4 of our hospital sites and 1 off-site location, we are currently in the process of going solar. We have 1 at our off-site location complete and 1 at one of our hospitals complete. In the end, the benefits of us going solar, our portfolio capacity will be 6,900 kilowatts or 6.9 megawatts of direct current. The AHS solar project will generate an average of 1,200 kilowatt hours per kilowatt installed. The total energy offset by this program is expected to be 8,200 megawatt hours per year. So basically the sum of the greenhouse gas emissions from the AHS offsetting with the solar equivalent is 5,800 metric tons of carbon dioxide for 1,277 passenger vehicles driven for 1 year, or 1,066 home electricity used for 1 year. And that's using one of the calculators, the US EPA greenhouse gas equivalencies calculator. So moving on, I focused on all of our environmental successes, but before I said we really can't do it without focusing on social equity and governance. So moving along to social equity portion, I'm going to read a quote from Armand Kinsey. It's our Vice President, Chief Diversity Officer. We are committed at AHS to addressing the needs of all populations with an eye towards cultural, linguistic, environmental factors, including social determinants of health. By ensuring we drive equitable outcomes across all of Atlantic Health System domains of care, we will reinforce stronger, healthier, and more resilient communities. So we recognize social equity as a priority. In doing so, this is just one example of the many that we're doing in this realm, but we have committed to 54 $8.5 million in purchases from diverse and small businesses. You could see the breakdown down below. 2.4 million from minority-owned businesses, 8.3 million from women-owned businesses, 1.9 million from veteran businesses, and 38.8 million from small businesses. Again, in the area of social equity, this year we also were able to introduce 9 new business resource groups. We launched them with team members and executive sponsors to really collaborate and address the diverse needs of minority groups within Atlantic Health and our communities. We're talking at these business groups about talent, personal development, recruitment and retention, which is an issue for us, and also community and social determinants of health. To round it out, we need to look at our governance. According to Eva Goldenberg, who is also on our ESG committee, she is the Vice President of Corporate Compliance and Internal Audit. We're always living the G in ESG governance. As an organization, through our compliance program, we're always making sure we're doing the right things. We comply with laws and regulations, and we adhere to our own internal policies and standards of behavior. So here we are all along working on all of our environmental initiatives and everything, but now we're taking our own medicine. We're also investing with an eye to ESG. So we're not only looking at our efforts in this area, but we're also looking at our portfolio of assets and investments as a serious responsibility, so we can hold our investment partners and managers to the same high standards that we're now setting for ourselves. So with the formation of the ESG, the signing of the pledge, it brings a lot of light and a lot of expectations to our group. So we're good at highlighting our accomplishments, but now we need to constantly look toward the future. And that's what we're doing as this group. We're looking to the future. We're setting our really aggressive goals now and looking at ways we can accomplish them. So I thank everybody for having me today. And I guess I'm going to turn this back over to Marjorie to see if we have any Q&A.
Karen, that was terrific. Thank you so very much. I want to now welcome the other co-director of the New Jersey Climate Change Resource Center. My colleague Jean Herbst joined us. And Jean, are you there?
I am here.
Great. Welcome. And Jean is going to help moderate today's Q&A. So I'm going to just turn it over to Jean. How's that?
Thanks. We have a lot of questions, and I'm not necessarily going to take them in order. I think I'm going to try to take them in terms of relevance to continue the conversation. So I think just building off of the presentations that we just heard, one of the questions is if either of the New Jersey systems or our other friends could talk a little bit about innovations in their own systems or innovations they're seeing elsewhere that might take some of the big thinking we've heard about today and apply it in terms of community-based planning. So beyond the operations of a system itself. So for example, in terms of how concepts associated with sustainability and climate and resilience might be integrated into community health needs assessments and community benefits. Again, love to hear from the New Jersey systems, but love to hear from everyone else if they know of innovations in that space. So I'll just open it up.
I can mention a couple points to that.
That'd be great. Thanks, Kyle.
You know, around the community health needs assessment, it's one of those things I've always been waiting for people to ask and to talk more about climate change. But you know, unfortunately, you know, we haven't heard as much. You know, I think you have things like mental health. You have all these aspects that obviously climate change has a drastic impact on, but it hasn't been pushed as much. So that makes it a little bit tougher, you know, for me to want to put it out in the forefront. But I will say, you know, not so much around innovations, but things we've really, especially during COVID, from a supply chain perspective, are now truly looking a lot more at local. So, you know, we partnered with this group, Common Market, actually during COVID, and giving out fresh boxes of local produce. But, you know, we've been, we just partnered with Common Market to really support a lot more local farmers, you know, signing contracts with them, guaranteeing, you know, that we will purchase X amount of food so that they can plan and know that we are going to purchase, you know, whether it's spinach through, especially for these farmers that do a lot with the schools, but that kind of during those summer months when the schools aren't in session, you know, it's a challenge to them. So now we're going in to kind of fill that void. So a lot more around the local area that we've been putting more into. But, you know, whenever the pressure comes to us about, you know, more community climate-based work, I mean, I'm ready, you know, so it's just a matter of it coming to the top.
Kyle, we know you're ready. Others?
I can second that from what Kyle said. Obviously, with the COVID and the pressure on our supply chain here, we really had to look into alternative sourcing channels during COVID. More local, we really had to, you know, think about it and reach out. That prompted us to create COVID playbooks. So not just that, we call them COVID playbooks, but now they're playbooks really for any emergency like that we could look at in each of our areas. Like what we did during COVID in procurement was unbelievable. What we did in every area of the organization during COVID was unbelievable. So we created that so that, you know, if we ever were to have situations like this again, we could go back and look. But definitely locating alternative sourcing channels was key for us.
Appreciate it. Jessica or Joe or anyone that want to add in terms, again, not necessarily just innovations here in New Jersey, but what we might be seeing in other places? Oh, are we at the cutting edge?
I would actually like to say, so I did talk about our cogen plant. Our cogen plant is capable of sustaining our entire facility in the winter months. So we can run like isolated, like our own little island, our own little city. So the cogen plant allows us to do that at both Morristown and Hackettstown. Overlook, sorry. And it allows us a surplus. So, I mean, during Hurricane Sandy, we did have the cogen plant in effect at Overlook, and we were able to stay open. We were able to provide electricity to our community members. We were able to keep a local gas station going. So again, in that resilience sense, all of the efforts that we're doing as far as energy are having a significant impact.
Thanks, Karen. Others? Anyone else? Joe, you're on mute.
Sorry, Jane. I wanted to, just in the interest of time, if I could address some of the questions that came up in the chat, the specific questions. Sure. HHS, if I could do that. I just don't want to miss the chance to do that before we close. So there was one question that related to whether HHS is planning to reopen the White House HHS climate pledge to healthcare systems that have not signed on. And my answer there will be kind of unsatisfying, but I would say we're seriously considering it. We've had a lot of feedback with people asking us to reopen it. And I think we should be sharing information on that in the next few weeks. So I would just say watch this space. If you're interested in the pledge, you know, we're hopefully going to be able to create an opportunity for people to re-engage there. The second thing that I noticed came up, I think it had to do with sort of helping clinicians to manage the burdens of heat impacts.
Yeah.
And I wanted to point to the fact that there are a couple of resources that might be of interest to the group. We launched in collaboration with CDC something called the Climate Change and Cardiovascular Health Collaborative, which is an opportunity to talk specifically about the cardiovascular impacts of climate change, but you know, it focuses relatively heavily on heat impacts, and in fact, the next session in March focuses exclusively on heat impacts. So I wanted to flag that, and I'll drop the link for that into the chat. In addition, you know, there's an underutilized resource in my book is the heat.gov website, which it really is kind of a clearinghouse for all things related to heat forecasting, but also helping populations to manage the burdens of heat. So I'll drop that into the chat as well, but those would be maybe my first two stops there. I'd also just like to say, I mean, I was really listening with great interest to the work that's going on at Hackensack and Atlantic Health both. And, you know, I mean, I think what you hear there is just a whole slew of really interesting and innovative approaches. But the other thing that really stands out for me that I want to underline is that we're finding that in the healthcare workforce, there's enormous, what we would call in the kind of quality improvement world, latent will, which is to say, you know, you have a lot of providers who either through their own personal home experiences or through the interaction they're having with patients that are coming in with exacerbations associated with climate change or harm associated with climate change, you have a lot of willingness to actually engage on this. And so I've worked for years in quality improvement and patient safety, and I've never seen anything like the interest and the concern that providers and other members of health systems are showing. So for me, that's where, you know, a lot of our excitement lies. I almost feel like we can't keep up with demand, which is exactly the situation that we want to be in.
Thanks, Joe. And I actually really loved Kyle's comments about how having employers, which is just what we hear from all employers, not just health systems, lead in this space is something that attracts some of the best and brightest employees. So I want to make one comment, and then I'm going to ask one closeout question because I'm keeping an eye on the clock. So my comment is, if you're on this call and you're interested in heat issues, the New Jersey Climate Change Resource Center, which Marjorie probably introduced you to earlier in the webinar, has produced a heat vulnerability index based on looking at some of the best heat vulnerability indexes in the country, and we think it's better than the best. And we will be hosting a presentation on it to let folks see what it is. Additionally, later this spring, we will be releasing web-based free data tools associated with health outcomes and climate change. It'll be called Health Adapt. And so for you to be able to keep in the loop on those things, I just put in the chat the website for the Climate Change Resource Center. Just go on there and sign up to get our emails, and then you'll know when both of those things are being done. So in terms of my closeout question, I guess for everybody on the panel, the work that's going on is amazing and impressive and inspiring. I guess my question is, what else do health systems need to be able to build on what they're doing now to move forward? Is it money? Is it regulatory reform? Is it training? What is it that we need to move beyond where we are right now? And maybe we can start with our two New Jersey systems. And we promise we won't tell your bosses what your answers are.
You know, I think a balance that we need a little bit of help from everything, you know, every different angle, you know, people, you know, to do this work. I think that it's almost a double-edged sword. You know, the more work you do, the more groups, more things you're involved in. And, you know, at the end of the day, as much as we've ingrained a lot of our sustainability goals into contracts with our vendors, that we partner with. So, we get support from that angle, in that, there's penalties if certain goals aren't met, but, we need, some FTEs, to help support the work. And, I think that's probably one of the big areas, that health systems need support. But that's where community partners, with like the groups like yours and others, where we can pull information from. We don't have all the time to do all the, research into this. We kind of just need to get it, digest it quick, put it on a PowerPoint slide, be able to effectively present and persuade a board or executives, and then we got to keep moving.
Yep. Thanks, Kyle. Karen, anything you want to add?
Yeah, I would absolutely agree with that. We would need the FTEs. Same sort of scenario here. We just need to keep moving, keep that momentum going, and keep it going. And like I said, my title is Manager of Occupational and Environmental Safety. So sustainability is falling in there, so we do have sustainability responsibility and designated sustainability people, but we're wearing many hats. So
Right. Thanks, Karen. And let me just ask Jessica and Joe, anything that you're hearing from the national perspective about what health systems are saying they need more of, or instead of, I guess, to be able to really continue to lead in this space?
I could, oh, sorry, Joe, if you want to chime in first.
No, please.
Okay. I would just echo what has been said thus far. I mean, at least in the working group, what we've heard from our membership, we have several associations, including the American Hospital Association, America's Essential Hospitals, others that have provided input on what they're hearing from their members. And I think it's a combination of all the above, similar to what Kyle said about, especially for those who have not yet started, just having, how to measure your emissions. So it's like the knowledge and education and resources needed. But then for those who are kind of starting their journey, like what incentives and policies can help them accelerate. So I think it's just a mixture of all the above, and the Action Collaborative is trying to fill some of those gaps and working across the sector, multiple partnerships to build these resources.
Thanks, Jessica. Joe, do you want to close us out?
Yeah, I think that's right. I mean, what we're hearing is that there's a deep need for knowledge and resources, for financial supports to actually make investments in the infrastructure that's required, and that's where I think the IRA is a massive opportunity. And then, we're also hearing from some groups that at some point, either regulatory simplification would be helpful, to allow organizations to sort of operate in slightly more modern ways, or in some cases, there are groups that also feel that regulation would be helpful. But we're starting with resources and incentives. That's where we need to start. Health system that's very burdened and constrained in the aftermath of COVID, and so that's where our focus lies.
Thanks, Joe. Thanks, everybody. Amazing panel. Thank you so much. I've learned a lot. I'm going to turn it over to Victoria Brogan from the New Jersey Hospital Association, who's going to close us out. Victoria?
Thanks, Jean. I appreciate it. This has been really an exceptional program, I'd say. We heard it today. Our healthcare industry, with its mission to heal, is voluntarily playing a role in fighting climate change. Clearly, we see the impacts of the changing climate, particularly on those with chronic illnesses. So our hospitals are committed to keeping our communities healthy and enhancing people's quality of life and delivering more value in healthcare. So before I close, I want to ask that everybody take back or reflect on some of the things that you heard today, you learned today. Reach out to your colleagues. to learn more about some of the programs that you heard about, to try to figure out how to bring it back to your hospital so that you too can get involved and reduce the carbon footprint. But finally, I want to thank our presenters, Joe McCannon, Jessica Marks, our hospital panelists, Kyle Tafori from Hackensack Meridian Health, and Karen Copa, Atlantic Health Systems. And thank you to my friends, collaborators, and partners, Jean Herb and Marjorie Kaplan. And to all of you who joined us today, thank you for being a part of this important conversation. Thanks, Jean.